Okay, this is John, and John's a patient of mine for several years, 5 years, 10 years maybe.
More.
And John routinely is very nervous of dental treatment, very apprehensive. And so about a year ago, we diagnosed that he had gum disease, and we decided to treat that. A lot of cavities. He works out of the country. And so he chose to be sedated for his appointment, maybe 2 or 3 appointments. So we sedated him, had him on a monitor, and had you sedated, and John actually got very comfortable, went to sleep, started snoring. And even during the treatment, I noticed that you had stopped breathing. And I would shake you and say, because I mean, it was like, the monitor was just starting to go off, your blood pressure was going up, you know, all the things. And you were maybe a little disbelieving afterwards that had happened, and you finally, I just kept on and said, this is a serious issue, and we talked about that. So share a little bit with, what was going on with you beforehand. I mean, you knew, your wife told you that you snored.
Right.
But you weren't aware, you hadn't heard of sleep apnea. You weren't aware that you weren't breathing when you snored or while you were asleep.
Correct.
Tell me a little bit about what you felt on a day-to-day basis that you thought was normal, but like being tired. You told me you were tired.
Right.
A lot of daytime tiredness, morning headaches.
Right.
Did you and your wife sleep in the same room, same bed?
Yeah, we did, until my snoring would wake her up, and then she'd go to one of our spare beds so she can get some rest, because she's a teacher and she gets up early in the morning and she drives out. So for me, that was not a very good way to keep going, and it wasn't getting any better. It was just consistent.
So that was pretty much almost a daily, nightly thing that she would. Okay.
I would say it was a very, very regular norm, basically. The tiredness, I always thought that I had enough sleep, but for some reason I was waking up tired, and I wasn't sure what the reason was. And
it had probably been going on so long you just thought it was normal even.
Yeah, but it didn't make any sense to me, you know. So I try to compensate for that with, siestas when I can, like falling asleep in front of the TV or something, or with a book. Try and make up for the lost rest.
Now, also, one last thing before we end. You went to your primary care physician, and did she notice some difference, or you just started sharing? Okay.
Oh, no. She noticed. She noticed the difference, and the first question is, "Wow, the medicine I'm giving you to control your blood pressure is doing fantastic." And I said, "Well, yes, it is, but in addition to that, here's what happened." And I told her what had happened here when I came for treatment, and I stopped breathing and snoring and all, and the appliance and the effect of it. Her response to me was, "Oh, my mom is looking for something like this too. She has trouble sleeping and getting rest at night." And her mom would be, I don't know how old she would be, but so I said, "Well, I need to get your mom to talk to to Dr. Carroll, because she may get some help. She may get a solution to her problem." And so I have asked your staff to contact,
they have. Yeah. Well, that's very good. So she even noticed that. That's outstanding. A great story. A great story. And the main reason I wanted to do this video is so that if there are other people out there that maybe they don't know about sleep apnea, maybe they do, maybe the snoring appeals to them, they're having an issue with that, whatever, just to see somebody else's testimony about what they went through. It could help some other lives, maybe even save some lives.
And all I can tell you is that I wished I had fallen asleep, stopped snoring, and stopped breathing
a long time
ago over the years, because obviously I had this issue, and I could have used and benefited from this if it was available years ago.
Right, absolutely.
But I didn't know, and I didn't even know I stopped breathing until you told me that last 2-3 weeks. 2 weeks ago.
Exactly. Very good then. Okay, thank you very much, John.
You're welcome.
And then we'll see you when you get back.
Yes, sir.
All right.
Thank you.